season's hitting early this year. 2 deaths have already been reported in North Carolina.
That's right, and in Georgia, more people are showing up with symptoms. And for some people, the virus can be especially dangerous and even deadly. In tonight's health report, WSAV's Joanne Merrigan is here with more on what you should know.
Yeah, that's right. 2 things. The season is starting about a month early, and we're seeing some of the most severe cases that we've seen in about 10 years. Health experts say the flu is not a cold. It's often more serious than that. And for some groups, it represents more than just a few days of discomfort. It can be deadly for the old and for the young. 10-year-old Natasha Olin represents that young group and is doing what all health officials advise, getting a flu shot. Natasha's mom heard about increased cases of flu and made sure her daughter got a shot today.
It's because I think it's a really good defense for flu.
Influenza vaccine is the best way that we know how to reduce your risk of developing influenza.
This year, we're seeing the early arrival of the H3N2 flu, which could mean a severe flu season. But Coastal Health District epidemiologist Robert Thornton believes the vaccine will cover the strain.
Experts, CDC, whatnot, they look at past patterns, current patterns, and try to predict the most prevalent strains of influenza that will be circulating, so they try to include those in the vaccine itself.
The biggest risk are the people who already have underlying medical conditions, so the elderly or young children who are very susceptible to getting dehydrated.
Dr. Zechar from Memorial Health says more people are turning up sick and that a shot can be important for every member of the family.
The problem is that if they don't get their flu shots, they can pass it on to grandchildren, grandparents, anybody who's children, elderly, or have a chronic immune condition.
She also says if you feel sick, it's not a bad idea to see your doctor, especially in the first 48 hours.
We have antiviral therapy that can prevent those complications that we see that land people in the hospital.
But the doctor says to avoid problems, just get a flu shot. At the Coastal Health District, there's still plenty of vaccine on hand. Have you had a flu shot?
Yes, ma'am, I did last week.
Okay, so everybody in the family?
Yes, everybody.
Well, flu symptoms include cough, runny nose, sore throat, fever, and achiness. Now, if you believe that you get sick from a flu shot, the doctor I talked to today made a point of saying people do not get the flu from the shot. She says anyone 6 months or older can get a flu shot and that it takes about 2 weeks to get immunity. Joanne Merrigan, WSAV News 3.
Well,